So DeepIntent has been making a concerted investment into helping to move linear television budgets and buying over to connected television, where the buying is more addressable and more measurable, and ultimately delivers better performance for our clients and their campaigns. The shift from linear to connected television is happening right as we speak. It's been happening for the last couple of years, but it's only accelerating. So this partnership with LG is just accelerating that trend even more. So we're excited to build our next suite of products focused on helping marketers make that shift from linear to CTV, where the efficiencies are higher, the efficacy of the campaigns are better, and ultimately we're going to drive better ROI for our clients.
So tell us a little bit about how this works and the platforms that you'll be on, the LG platforms, and the kind of inventory that that's available, and how you see this thing rolling out.
So LG has access to over 20 million households, and that's a good slice of the population. That's a critical part of the US patient population and healthcare provider population that we're going to have category exclusivity to on our platform, meaning that for healthcare marketers who are currently buying that inventory, they're going to have to bring that over to DeepIntent, where we can use our best-in-class tools like our targeting HCP and patients, as well as DeepIntent outcomes for measurement and optimization of those campaigns. So what we're doing here is we're taking the best that LG has to offer, which is their amazing media properties, getting priority access to that on behalf of our clients, and using our data-driven tools to help make those buys more efficient and more effective.
What about creative and both the creative ads themselves and also the targeting, which is so important? Tell us how that fits into this scenario.
Yeah, so a lot of our clients have been using 30-second, but mostly 60 and 90-second ads. And there's really been a scarcity of supply to some degree especially for the 90-second ads. With LG, we're prioritizing 90-second fulfillment. So we're going to get better access to longer form ad content, where you need to have that for pharma. For example, the ISIs that are there, right? The important safety information. Everybody who's seen a pharma ad knows on television, what I'm talking about, right? The long side effects and whatnot. But those are regulated. You must have those in your creative. So what we're doing is we're helping make it easier for pharma to bring over those television assets into the digital formats to make it allow them to run and use all the targeting and measurement capabilities that we have for connected television.
Now, Chris, we've spoken about targeting, with you, just explain a little bit more about the opportunities for marketers to target their message. And of course, for some of these pharmaceutical marketers, it's a very defined audience. Not to get too deep in the weeds, but how does targeting for CTV, what are some best case uses that you see?
Yeah, so when programmatic came on to the scene, several years ago, and healthcare programmatic, I would say, really took off around 2017 and 2018. The reason why it took off was that we went from marketers went from buying in endemic placements, where obviously very contextually relevant but limited in scale, to using privacy safe, data driven methodologies like modeled audiences to actually reach patients based on conditions. And again, we're not reaching patients on a one-to-one basis. We're using data to model that, to find correlations between demographics and disease. And so there's a lot of data processing and data analytics that happen behind the scenes to make the targeting that we do precise, yet not precise enough, where we're obviously with concerns for HIPAA, but we're making the campaigns more targeted. And so that, what I call a kind of quantum leap from contextual to audience-based buying, we were really at the forefront of bringing that capability to the marketplace. And now we're seeing that same quantum leap happen in television. And so with the advent of CTV and that channel being adopted increasingly by pharma, we're allowing marketers to use that same quantum leap, or to make that quantum leap, to using this data-driven targeting methodology in what they would otherwise be more linear television environments. So we're excited. We think that this is going to help drive even better efficiencies. In addition to that, we also have access to LG Ads ACR data as well, which we'll be using to help marketers understand things like incrementality, the additional incremental audiences that they can get using CTV, going to actually put numbers and allow them to plan against that data as well. But in addition to that, we're also going to help actually measure the effect of the CTV buy versus the linear buys. So when you run a linear campaign, we know that for anybody that's ever turned on the television, let's say the local news, we know that those ads can generally be fairly untargeted, to say it at best. So what we want to prove out is that there actually is a benefit, right, to running better targeted advertising when we talk about things like audience quality or the amount of users reached, the unique users reached or households reached. How many of those households actually have a patient that's relevant? Those are things that we can now measure for both the linear and this connected television buys that are happening. So we're going to roll all this into our platform, and we're going to help marketers understand and get that transparency into what is actually driving the effects and the results of those campaigns. So very exciting times. We're going to be launching a couple different new products in 2022 related to that.